Hi, I'm Dr. Manny Pena, and today we're going to talk about microneedling with PRP. PRP is platelet-rich plasma. We use your own blood, concentrate the platelets, which have the substances which you can stimulate your own hair growth with the help of microneedling and some injections underneath. The process is simple. We draw your blood, prepare and concentrate the platelets, and then we anesthetize the area to be treated, the scalp or wherever you want hair growth to be stimulated. Next, the microneedling machine, which actually pokes holes through the superficial layers of the skin, is used to stimulate the hair follicles. The platelet gel is then applied and then injected underneath the hair follicles, stimulating not only the hair follicles to continue in the growth phase, but also to stimulate those hair follicles not in the growth phase, but dormant or asleep, to come back and wake up and produce thicker hair. So what are we talking about? About 40% more thickness and about 20% more hair follicles at any one time, and they're producing longer. You get stimulation starting around 3 months. So our patient had a treatment around 6 weeks ago. We might see some early sprouting, but more than likely it'll take the second treatment along with some vitamins and some topical creams to really see the improvement. Let's go take a look. So blood is drawn. We collect them in 2 tubes to concentrate by centrifuging or spinning down the blood. The platelet is then separated and used for the procedure. We're marking the area of the ring block, which encompass the entire area to be treated. So he has loss in the top and in the back. This is the set of needles that allow us to quickly administer the anesthesia in a ring block fashion. This, we will let the anesthesia take effect, and then the platelets preparation should be ready for us to use. After collecting, they're placed in a centrifuge, and we centrifuge to concentrate the platelets. The platelets are concentrated on top, and now they're agitated so they can be injected in a concentrated form. So now we draw up the platelet gel in a concentrated form in preparation for the microneedling process. Here we're dropping a little of the platelet gel before the microneedling process. This will be driven into the scalp. I think the anesthesia has worked well.
Doesn't hurt at all.
Intermittently adding more platelet gel to be driven in. Now we're getting the occiput, or the back of the head. It's an area very common of male pattern baldness, and is often seen as one of the early ones to do well with this treatment. They respond at around the 30-month period. Now we draw up the rest of the platelet gel to be injected directly underneath the hair follicles for further stimulation. This is placed between 1.5 and 3 millimeters in depth, allowing for maximally bathing the hair follicle units and the natural area. Okay, how'd it go?
Great!
Good humor goes a long way.